Hey, Professor Gould here again. We're going to continue our discussion of the appendicular muscles by talking about the hip flexors and the hip adductors. So let's start with the hip flexors. Your primary hip flexor is this big muscle called the iliopsoas. It starts out as two different muscles, the iliacus and the psoas major, and inserts as one muscle, the iliopsoas, on the back of the femur. So it's going to pull the femur toward the trunk of the body. Okay, so the iliacus sits in the iliac fossa on the os coxibone. The psoas major originates on the lumbar vertebrae, so it pulls the femur toward the lumbar vertebrae. So these work together to bring the thigh forward. The psoas minor is this tiny little muscle here, which is not on a lot of our models and diagrams. And in fact, your book doesn't even say what it does. It's actually a little evolutionary leftover. A bunch of people don't even have it. But it helps to flex the lumbar portion of the vertebrae. So it connects the pubis, the pubic bone, to the lumbar vertebrae and helps to flex the lumbar spine. I know, who knew it? Well, you don't need to know it. You do need to know the psoas major and the iliacus. By the way, for those of you who like steak, the psoas major is the filet mignon. Yeah, very tender because cows that we raise for beef don't really walk around very much, so they don't use their hip flexors very much. All right, now the Sartorius is a really funky little muscle. It originates on the anterior superior iliac spine, and then it goes across the thigh, wraps around the medial knee, and inserts on the medial side of the tibial tuberosity, which is just wackadoodle. It is a synergist to thigh flexion, to bending the thigh, but it also helps to laterally rotate the thigh. So if you think about bringing the medial side of the knee toward the outside of the thigh, that's what you do when you cross your legs. And then it also helps to medially rotate the lower leg. So laterally rotate the upper leg and medially rotate the lower leg. What? So if you sit cross-legged, okay, crisscross applesauce, you pull your knees away from the body, and your knees laterally, and your lower leg medially. Okay, so you've laterally rotated the upper leg, medially rotated the lower leg. That's your Sartorius muscle. What is the point of that? And where does this weird name come from? Because this doesn't make sense. This name comes from sartorial experts who are tailors, people who make clothes. And when they're fitting clothes, they often sit on the floor cross-legged so that they can pin a hem. And so this motion by the tailor is where the name of this muscle comes from, Sartorius, right? It's really easy to identify because it does do this path across the anterior thigh. Now, next up, we're going to talk about these muscles in the medial compartment of the thigh. Okay, so this diagram is showing us a cross-section through the thigh. And we can see that in the anterior compartment, we have the quadriceps muscles, and then we have the little sartorius over here on the medial side. And then the adductor muscles here medially that are going to pull the thighs together. And then on the back, we have the hamstring muscles, and we'll come to them in another video. All right, so the adductors, there are 5 adductors. The most superior is the pectineus, and these are going to connect the pubic bone to the femur mostly, except this last one that connects to the tibia. The pectineus inserts on the femur just below the iliopsoas. The next one is the adductor brevis. You remember brevis means short, so this is a short one. It's not the shortest. The pectineus is the shortest. Then we have the adductor longus, which on some of our models is going to look just like a round muscle. It flattens as it reaches the femur, but up here it looks round, so just be aware of that. And then the adductor magnus sits deep to all of these, and it actually inserts way up the femur all the way to this medial epicondyle. Then the gracilis is this narrow band of muscle that goes all the way down the medial thigh and inserts on the tibia. So all of these adductor muscles are going to work to pull the two thighs together. So those are your hip adductors. So here they are separately. pectineus, adductor brevis, adductor longus, and gracilis. You can see these are all sort of narrow bands of muscle. And then the magnus is called the magnus because it is so much bigger than the others. It is also deep, so it's more visible from the posterior side when we remove the hamstring muscles. We'll talk about that again later, but you can see it's got this really wide insertion on the femur. Okay, so those are your hip adductors. Here are a couple of models so we can see some of these muscles. This is the psoas major here. This is the iliacus. Okay, so the two of these together insert down here as the iliopsoas. And then over here, we can see, here's the sartorius muscle there. Okay, this wide, flat band, well, narrow band. This is the gracilis here. And then we have, this is a little bit of the adductor magnus. This is the adductor longus. You can see how it looks like just a big round muscle. It flattens as it gets to the femur, but here it looks round. Here's the adductor brevis there. And then this is actually the iliopsoas. The pectineus is in here somewhere. It's not a great model for the pectineus and the adductor brevis, but we do have a good model of the gracilis, the adductor magnus, and the adductor longus, the sartorius, and then this is probably the model I'll use to ask you about the psoas major, the iliacus, and together iliopsoas. All right, so that's that portion. Next up, we are going to talk about the some more of the muscles that move the hips.